Today, we're diving into the science behind gallbladder cancer, a type of cancer that, honestly, doesn't get a lot of the spotlight. We're going to break down the research on what are called complementary therapies. These are evidence-based approaches that can actually work right alongside standard medical treatments to support patient outcomes.
And that brings up a really important question, right? When you're facing a cancer that isn't as widely researched, how can you find reliable, evidence-based ways to support your treatment? Well, that's exactly our goal today, to dig into the data and see what it tells us. So let's get right into it. We're going to break down the research on several compounds that show some real potential. Now, I have to be super clear. This is not medical advice. The whole point here is to give you the information you need to have a more informed, more empowered conversation with your own doctor. Okay, let's start with something you might not expect: iron. It's absolutely essential for life, but it turns out the way cancer cells use and, frankly, abuse iron can become a critical battleground during treatment. Think of it like this. Certain cancers figure out how to hijack the body's entire iron regulation system. They ramp up a protein called ferritin to basically create their own private iron stash, and they use that iron to fuel their growth and spread. And this creates a really dangerous imbalance. And the impact of this iron problem, it's staggering. Research shows that when a cancer successfully hijacks the body's iron, it's linked to a 70% increased relative risk of that cancer progressing or even coming back. That is a huge number. So, how can we possibly counter this? Well, the research points to something called lactoferrin. It's a natural, milk-derived protein that's one of the body's main iron regulators. By helping to bring back that normal iron balance, it has the potential to fight both iron deficiency and the cancer's messed up use of ferritin. All right, now we're going to shift gears from a specific prebiotic to something you almost definitely have in your medicine cabinet right now: aspirin. And it's a totally fair question to ask. Could something so common, a simple low-dose pain reliever, actually play a role in cancer survival? Well, large-scale analysis of patient records suggests the answer is a resounding yes. The data here is really compelling. One major study looking at patient records found that for biliary tract cancers, and that includes gallbladder cancer, aspirin users saw around a 40% improvement in relative survival compared to those who didn't take it. And check this out. Here's a crucial little detail from that research. The benefit was actually a bit higher for patients who started taking low-dose aspirin after they were diagnosed. This suggests it's not just about prevention, but it might have real value as a complementary part of a treatment plan. Okay, our third area of focus highlights another one of those fundamental elements we often take for granted. And no, we're not talking about some new diet fad, but about a basic electrolyte: sodium. It might sound almost too simple, but having the right electrolyte balance is just critical. Research is now finding that low sodium levels, a condition known as hyponatremia, can be a major red flag for poorer outcomes, especially for patients who've had surgery. And the numbers really back this up. In patient data, low sodium levels were tied to a 1.6 times higher risk of the disease progressing after treatment. That's a pretty significant measurable impact from a basic metabolic marker. So the takeaway here is that having sufficient sodium levels, particularly in that period before surgery, seems to be essential for achieving a longer-term, sustained response to treatment. It's really a foundational piece of the whole puzzle. Now, beyond iron, aspirin, and sodium, the research points to a whole range of other compounds that seem to disrupt the different pathways cancer uses to survive and grow. Let's just do a quick run-through of a few other promising areas. First, you've got berberine, which might help block a cancer's access to the sugars and fats it needs for fuel. Then there's curcumin. That's the active stuff in turmeric, which is really well studied for its ability to lower body-wide inflammation. Research also points to urolithin A, which helps support healthy fat metabolism, and citrus pectin, which can actually bind to heavy metals like copper that some cancers use to grow. And finally, there's astragalus, an herb from traditional medicine that's showing evidence for helping to rebalance inflammation that's driven by the immune system. Okay, we've covered a lot of data. So what's the big takeaway? It's all about recognizing your role. You are an active, informed member of your own healthcare team. This table really gives us a nice, clear summary. You can see the direct risk reduction linked with aspirin, and then the high but indirect impact of things like lactoferrin for iron balance and astragalus for immune inflammation. These are really the key takeaways from the research we've just explored. And listen, this is the most important slide in this entire explainer. None of this is a substitute for professional medical advice.
The entire goal of gathering this research is to empower you to have a proactive, informed, and engaged conversation with your oncologist.
So the clear, actionable next step, it's to take what you learned here today and use it to build a list of questions. Questions about your iron levels, about systemic inflammation, and about whether any of these complementary approaches might be a good fit for your specific situation.
So we'll leave you with this final thought. Looking at all of this data, what is the very first question that pops into your head to ask your doctor? Because that question, that's the start of your next, more empowered conversation.